Hi everyone, and welcome to the Objectif Performance Podcast, the podcast to keep improving and reach the top. I'm Julian Astoric, French physiotherapist and SMT coach. Every 2 weeks, I'm gonna interview sport physiotherapists, physical trainers, SMT coaches or others who follow and take their athletes to the highest level. The first part of the interview will be about their journey. Where do they come from? Where did they study, travel, and start their career? Then, what they are currently doing and what we can learn from it. What is their current research topic? How can this improve our skills? And finally, we will discuss their mentors, their favorite books, and how can we contact them. As usual, I'm counting on your support. So if you like the episode, don't forget to give this episode 5 stars on Know Minut as well as on Spotify and Apple Podcast with good comment. In the same way, I encourage you to share this episode on social media, especially in story on Instagram or via a post on LinkedIn. It's clearly what helps me the most to make this podcast known. Have a good listen, everyone. Hi, Colm.
Hi, Julien. How are you?
I'm fine, thank you. What about you?
Good. Surviving here in the Irish rain in a typical day in the month of April or May. Lots of sun and lots of rain, but not warm.
Nice. I'm really happy you accepted this interview, and I would like to thank you first.
Oh, well, look, it's a real privilege for me to be asked. I've been following your podcast for a while now, and you've had some great guests, although I can't say that I understand all the French too well. It's much easier for me in English, obviously, but I think you're doing a good job, and I like the look of the clinic that you guys are working in.
Thank you very much. What's your definition of performance? What does it mean for you?
Performance. Oh, okay. So it depends. I suppose performance in my everyday life as a physiotherapist probably means carrying out or executing my job to the best of its ability. So if I'm dealing just with a patient, be it a player or somebody who's a player's mother or a player's brother or any type, you're trying to provide as good an experience for that patient, but really you're trying to get to the bottom of why they're here to see you and how you can help them. So in terms of performing, to do that, you need to be, I suppose, your mindset needs to be sharp. You need to be present. You need to be a good listener. And for me to perform, I suppose I also need to be on time. I need to be keen and interested in what I do every day because I suppose it's the type of job that you cannot just drift through the day very well. You have to be present and try and help the person as much as possible. So for everyday performance, they are the main things I suppose I look at. But nice. The other side of that, for me to perform at home, it's possibly more complex. I have four young children, and the oldest is 5. So it is maybe I'm not performing to the best of my ability there. It is much more complex and more difficult than any patient, but it is also much more fun.
You can be on top level in everywhere in your life, you know?
Yeah. No space, no time.
Yeah, exactly. And now we are at the surgery, a sports surgery clinic in Dublin. But what's your background? Where do you study? Where do you start?
Yeah, so I'm currently head of physiotherapy in the sports surgery clinic in Dublin, Ireland. It's a sports medicine department as part of a pretty big orthopedic hospital where we have, I suppose, over 30,000 patients a year coming through the door. In the sports medicine clinic alone, it's exceptionally busy. There are 8 sports medicine consultants. We have over 25 physiotherapists, 5 strength and conditioning coaches as part of a large lab, biomechanics lab, that provides a service for a very broad type of patient, but it is mostly musculoskeletal and mostly orthopedic, but it is very varied as it is technically a self-referral service, and we also cater for referred patients. Now, how I got there, to answer your question, is probably it's amazing to think I am almost 15 years qualified this year. That makes me feel old. I went and did physiotherapy as my degree in London, in the University of East London. And while at the time I was not sure if physiotherapy was going to be right for me, I felt I wanted to do some sort of job that had, I suppose, a professional status to it. And I liked the idea of helping people. And I also had a huge interest in sport. And like a lot of physios, I immediately thought, just go and do physio and you can work with any team you want in the world. But it's not that easy. The big advantage of studying in London was possibly the NHS. And although you hear lots of bad things about public health services, the reality was, as a training centre, any exposure I had to staff in jobs in those hospitals, those big teaching hospitals based within London, was generally phenomenal, in that I had huge access to very skilled clinicians with lots of research and academic ability, but mainly clinical ability. So that was the biggest learning curve throughout my time as a student, and that allowed me to start my career in the NHS as a junior physiotherapist. Much like any physio, I did my rotations of 4 to 6 months in respiratory, orthopedics, neuromedicine, and then physiotherapy as we know it now, which is outpatients, where at the time before I did physio, I only thought that was the type of physio you could do. But I found that having done some respiratory and orthopedics, and even in particular, I suppose, neuromedical, I thought it was a very good base to get as a junior physio. And to this day, I will always recommend, if you get the opportunity to do respiratory, it's very, very helpful in your life as a sports medicine physiotherapist. So from there, I did about 2.5 years working the Royal London. Worked with a guy called Andrew Macaulay quite closely, who you might have come across now. He's on the teaching circuit based in the UK. And also a couple of other really good physios who are now working in Ireland, actually, Katrina Murphy. There were people who were very helpful to me at the start of my career. And through various people, I realized that the next step on the ladder was to do a master's degree. So doing some research into that, I came to the conclusion that the place to go was Australia. And a guy called Declan Lynch, who went on to work with London Irish, Bath, Arsenal, said to me that if you want to learn how to drive a car, you can go on a PlayStation or you can practice in a car. He says, but if you want to learn fast, you got to go to the Nürburgring and try and get Michael Schumacher to teach you. So I ended up going to University of Queensland, and my I suppose biggest mentor there was, Gwen Jull, Bill Vicenzino, Paul Hodges, Julie Treleaven, Julie Hydes was just gone. There was a huge scope of really experienced physiotherapists teaching on that course. And that was 2010, and seems like a lifetime ago. And I was completely immersed in physiotherapy. I lived with 4 other students. All we did all day, 6 o'clock in the morning, Queensland, sunshine, physiotherapy. And then at weekends, go meet friends and go surfing or falling off, more likely. But it was a great year of my life. Yeah. Great year. And I was planning on staying in Australia. I don't know if you have been.
No, not yet. It's one of my plans.
Yeah, so Queensland is very hot. So for an Irishman with skin like mine, it was
Like
extremely
red.
hot. But yeah, I was keen to stay, but a job came up that I applied for, and it turned out that Declan Lynch, the guy I mentioned, was just after being appointed to head physio of London Irish. So
Okay.
I did an interview with him and a few others to see if I could join in December of
Mm.
2010 to, I suppose, take over the academy
Mm.
as a physio. It was a new position. And I came off the plane to London, and within 48 hours, I was standing in Twickenham Stadium in the dressing room looking at doctors surrounding Bob Casey's knee, and he was after having a big knee injury. And in Twickenham that day, there were two big games, so 80,000 people. It was a
Okay.
big, big change.
Wow.
so,
Wow.
uh, so I said, "Wow, this is pretty cool. Professional sport all of a sudden." And in London Irish at the time, they were a top four club in the Premiership. If you
Okay.
remember,
Yeah.
2011, 12, lots
Yeah.
of
Yeah.
really good players. And uh, I was in charge of what they call the ACE program, which is the academy program that allows players to accelerate into senior setups. So they have elite player development group across England in several of the big clubs. I don't know if they do
Okay.
this in France,
Not
but
sure. Yeah.
not all the players were
Okay.
19, 20. Some were 17, 18.
I'm
And
not sure. Yeah.
of that group, uh, they were exceptional. Jonathan Joseph, Anthony Watson,
Whoa. Yeah.
um, Max Laheath. I'm trying to think. Lots of guys who went on to play for England. Kieran
Yeah.
Lowe
Yeah.
played with Scotland, I think. There was even Dave Ceci played with Italy. There was even more that I'm forgetting, but so lots of these. Marlon Yard was there, I think. I don't know where he is now. Um, so I got to work with some really, really good guys. Andre Quinn, who went on to work in the Premiership for a long time. Toby Booth is still head coach now somewhere. Mike Catt was just starting off his coaching career,
Yeah.
and it was pretty good experience for about 2 years,
Yeah.
and then it probably came to a point where the club was slightly changing. Some of the older players were retiring. And I thought it might be good to get some experience in private practice, but then a job in Munster rugby came up,
Mm.
and I'm from Kerry, which is southwest Ireland.
Okay.
Not quite as sunny as Bordeaux, but but we it was Munster. Obviously, is really, really important where we come from in terms of
Yeah.
it is part of your identity if
Yeah.
you are a rugby supporter. And while
Yeah.
Gaelic football would be my number one sport,
Okay.
supporting rugby as a family was always something we did. And that was a huge opportunity. The interview process was very difficult, but I somehow got lucky. And at the start of 2012 season, I moved to Limerick, a city just an hour or so away from where I grew up that I knew fairly well. And that was an amazing job, really. I was just lucky enough to get there at the time when we got to a Heineken Cup semi-final. Probably should have done better. We had some amazing players then, Paul O'Connell, Ron O'Gara
Yeah.
in particular,
O'Gara. Yeah.
they were the leaders, but even some of the young guys, Peter Manny was there, so there, Conor Murray. So, I was very lucky to get time experience with some of those players, but in particular, what I really got access to was like a guy called Bryce Kavanagh was head of strength and conditioning. He's now head of performance for the FA in England.
Okay.
Aled Walters, PJ Wilson. So Aled was the head of performance for South Africa when they won the World Cup, and now he is with
Okay.
Leicester. He's amazing. PJ Wilson has been at Bath. Physio Colm Coakley I worked closely with. And lots of coaches. Obviously, Axel Foley was based in Limerick at the time. Ian Costello. I just think of other players like Felix Jones. So it was an amazing experience. It was very tough, but I was able to learn an awful amount in that job. It was quite different to London Irish because at the time, and this might be hard to imagine, but half the squad lived in Limerick and half the squad lived in Cork. And they were 1 hour, 30 minutes away from each other.
Okay. And how do they train together? How do they live together?
Crazy. Yeah, they didn't live together. So they train together on a Tuesday and a Thursday. And on a Tuesday, we train in Limerick, and a Thursday, we train in Cork.
For a team of this level of performance, it's crazy to think they just train twice a week together, all together.
Yeah, true. And they did that until possibly 2016, maybe 17. I can't remember when the new centre was built. Now, the new centre is really state of the art still. It's really, really good. And most guys have moved to Limerick, but lots of them are still living in Cork and commute. So it's about 90-minute drive. On a not a motorway, a bad road. So that was good because from my point of view, the head physio at the time gave me a lot of responsibility, and allowed me to be responsible for some of the players that were playing international and even with the Lions Tour at the time, and that allowed me to develop quite quickly. But it also allowed me to make a lot of mistakes. And that's, I suppose, one thing that I feel helps you grow in an environment where you can get huge exposure and experience really quickly to a very demanding group of players with very high standards. And when it's your own club as well, I always feel like that means a little bit more.
Yeah, like pressure and...
Yeah, I think so. A lot of pressure, yeah. But so I was going out with a girl, my wife now, and she was living in Dublin, and a job came up in Dublin, and it was a chance to work with, some really good people. And again, it was a very tough interview. And I took a job in Dublin, even though it was very hard to leave Munster rugby. Yeah. I took a job in Dublin and decided to work in a clinic for a couple of years. So the clinic, as I mentioned, is the sports surgery clinic. Now, at the time, we had about 14 physios, maybe less actually, maybe about 10. And now we have about 25. And the department is very mixed in that we have biomechanics, strength and conditioning, and physiotherapy, working with sports medicine and nursing, all part of a huge orthopedic hospital. So it's a really big learning environment. We really push continuous professional development, lots of teaching, lots of joint sessions. We try and develop our standards internally, and then we try to do an external conference every couple of years. And it's a busy place too. So again, a huge opportunity to learn.
Do you never regret to leave Munster? Wouldn't you like to stay more in Munster?
As a job, yeah, I loved it. Probably don't regret it as such, because I ended up getting another opportunity to work in rugby, which I was lucky to get, because the job came up part-time in 2017 with the national team. Luckily, Dr. Andy Franklin Miller and Dr. Aina Falvey in the sports, so Professor Aina Falvey now, actually, he is a sports medicine consultant and runs a sports medicine program in the University College Cork, but more importantly, or probably better known as head of medical for World Rugby. He's also my PhD supervisor. So he was working in the sports surgery clinic at the time, and he had been national team doctor, and Dr. Kieran Cosgrave, the current national team doctor, was working there. So I was getting experience with lots of really good people. and a job came up to work with the national team in 2017. And while it took a little bit of negotiation, and I don't think I actually interviewed that well for the job, it was quite scary meeting Joe Schmidt for the first time in an interview. I was lucky to get working with that team through the good times, which was 2017. They were on the way up. 2018, they were obviously really, really up there, and expectations were high going into the World Cup in Japan. So during that time, again, there was a lot of pressure. I was probably 70% of my time with the rugby, 30% with the clinic. So I was fortunate to be able to stay attached to the clinic during that time. It probably would have been better to be 100% in the rugby job, because I often found the transition very difficult to move back into clinic, having been away or in camp for 7-8 weeks. But it also, I suppose, the advantage of having two different environments is it pushes you to learn and to move on from the job as well. But I didn't get much recovery time when I reflect back on it. So there's definitely it needs to be a permanent job, or a full-time job, should I say? If you're working with a team, it's hard to do both at that level, anyway. But it was a fantastic experience. Again, 2017-18 was under Joe Schmidt. After the World Cup, then Andy Farrell took over. So you got to experience with some amazing coaches with really high demands, operating at the top level. And the other big thing, I suppose, in an international environment is you get really well looked after. You live a little bit like a king. You get the best of hotels, you get the best of travel experiences. Facilities are amazing. The new, RFU facilities is as good as anywhere in the world. And you get the best players, some of them have played in France, as you know. So Rory Best was captain, and then Sexton took over. And, so they're amazing people to work with, because they really push you very hard every day. Their expectations are high. Their expectations are constant, and it is a really good experience. Also learning how to travel with a team in different time zones are things that you would never really get to do in a lot of sports. But in international level, when you're traveling around the world, especially rugby, you get opportunities to learn new skills and work with people. So I had a very close relationship with Jason Coleman, the head of strength and conditioning. He still is in that job. And, that we had a really good medical team at the time. And, the soft tissue guys. So Dave Revens, Willie Bennett, those were guys that were there 20 years. And then you had new guys coming in all the time into the setup. You have a full-time nutritionist. You have a head of analysis, Finney Hammond, so it was great, because when you're doing a contact session in international level, you're almost doing it with a coach and the player, and you're very involved, because even though it's the top level, we had 2 physios for 45 players coming to the World Cup. And we were in camp for nearly 23 weeks in a row. And it was extremely busy, very pressurized, and you're trying to make decisions to help the team and to help the player. But it was also difficult when you have a small family at home and you're trying to get home once or twice a week if possible, but you're living in a hotel. You don't live at home. So that was also, I suppose, a big factor on the outside that makes the job, if you're going to go and work in a job like that, you need to be able to commit to it fully. But the biggest advantages or takeaways from that is you get to meet really good people. You get to really live in a team environment that has its own culture, and it is when you're winning as well, you feel a really big part of it, and when you're losing, you also feel like, what can I do better? How can I help the team further? And you have to be able to provide as much support as you can for the players, emotionally, physically, and you always have to try and be one step ahead so that you can remain calm and composed when you're doing your job. And I suppose you have the added pressure of every game is on TV. Every game, in a country like Ireland, 4.5 million people or whatever it is. If you include rugby, it's including Northern Ireland, so that's like 6 million people. A lot of those people are very interested in the game, and injuries are a big deal. But that's all a sideshow and doesn't really affect your day-to-day job, But when you stand back and reflect on it, it's obviously something that was a great experience to get a chance to do for a couple of years.
Yeah, fully agree. And how did you had the idea to make a PhD? Or how did you get this idea, and how did you start, and how did you manage this?
So, if I go back to around 2014-15, when I was starting in the sports surgery clinic, part of the attraction was the ability to do further education. And maybe my mother instilled this in me, or perhaps even my father-in-law, who was a professor. Both my wife's family and my own family, would have had a big interest in the academic side of things. And for me, academia brings validation. And although it's, not the only thing, and experience is really, really important, I always feel that having a degree or having a certificate of some kind gives you a little bit more accreditation and backing to prove, this is who I am, or this is what I do. So for me, the idea of doing a PhD was attractive initially, because guys in the clinic like Enda King and Neil Welch were already started on the process of doing their PhD, and the clinic was set up for orthopedics, like I said. So ACL was a big attraction for opportunities to do PhD, because we had almost 1/3 of the ACL repairs in Ireland were being done in our hospital. So we already had a huge population of ACLs walking through the door every day. So
it's crazy, yeah.
But that didn't fit my clinical interest. And I, having been in UQ, possibly had more of an interest in spinal. And I thought, okay, if I'm looking at spinal, I possibly think more cervical. And so, okay, neck was my thing. But then obviously working with Éanna Falvey in particular, and having had, by this stage, 4 or 5 years experience in professional rugby, I also realized that concussion was a huge problem and something that really interested me, and I knew very little about. And I said, okay, how do I look into this more? How does this fit with the clinic? And we got amazing support from the clinic itself. So the clinic is, the director of medicine is an orthopedic consultant, Mr. Ray Moore. And if you've ever come across him, I don't know who the most famous ACL surgeon is in France, but this guy is up there with anybody in the world. But on top of that, he's just a really good person. He has incredible energy and vision for the clinic. And he supported Andy and Éanna in how they wanted to set up the sports medicine department. And that allowed people like me to try and follow an interest, or a clinical interest. And one thing I was given good advice on is, if you are going to do a PhD, you need to have a very, very big interest in the topic. Like, you need to be almost obsessed for you to get through this. And ACL didn't fit with my clinical interest, really, to be honest. So what I would like to go back and look at what my original question was, but what we ended up doing was setting up a fairly large scale study in schoolboy rugby. And schoolboy rugby, is it big in France? If you are Antoine Dupont or whatever, do you know what school he played for? Like, is the school famous for rugby?
No, yeah. Not in school or in then in university. Okay, it's not like USA or UK system. It's not very common to play for your university at a big level. You
Okay.
used to play with academic from professional top level teams, but you don't used to play with your university team, you know?
Yeah, so look, in Ireland, it's a really big deal. Ireland has 4 provinces. Okay, so the 4 provinces are Leinster, which is where Dublin is. Ulster is up the north, Connacht is the west, and Munster is the south. So the 4 teams essentially are all professionalized based on their location. Okay, much like the French clubs, yeah, and English clubs. That's how rugby works. But what you have then is that the province has counties or smaller areas. And in Ireland, you have public education and private education. And often private education is associated more with rugby, possibly, and those maybe hockey, and public education, where I would have gone to school, is possibly play more soccer, Gaelic sports, maybe basketball, more varied sports. So the population that plays rugby is quite small and concentrated. Now, in Dublin, you have more private schools than anywhere else. These private schools tend to be in the cities, so that is where rugby tends to be played more. And certainly at the highest level, rugby is played in the private schools. So the feeder system to get to play, if you want to play for Leinster, if you want your son to play for Leinster, then you possibly need to think about where he's going to go for school to give him his best chance. And you possibly need to think about
private school.
Yeah, I mean, there is a club access. Everybody has a chance. But the best schools have the best support system. Some schools have their own strength and conditioning coaches, full-time coaches, physios even. So, and that's very the same as England. So you I suppose why that's relevant is that we thought looking at the schoolboy system would be very interesting, because first of all, we weren't entirely sure how much concussion there was at schoolboy level in Ireland. We had a fair idea, although it wasn't recorded very well, what was happening at professional level in Ireland. And since then, there have been 2 epidemiology PhDs on injuries in schoolboy rugby over the last year or 2 in Ireland. So they've been really, really good. So Therese Leahy is one of those, and Katrina Yeomans as well has also looked at them. So they're both out of UL, this IRIS program. I don't know if you have come across it, which is supported by the RFU. So they've really improved the epidemiology now around schoolboy rugby. And I, along with the support of the clinic, we set up a fairly large study to look at 5 premier schools in Dublin, where we did a broad baseline test, which included physician screening, a questionnaire, which was very, very broad, got a fairly extensive past medical history, injury history, concussion-related questions, a baseline SCAT, and even broader questions around behavior and thoughts on concussion and concerns or worries about concussion. We did CogState as our cognitive test, although now we tend to use Impact in Ireland. We looked at the autonomic system using the Buffalo Exercise Threshold Test. We did a blood workup to measure hormonal changes and sleep changes. Were recorded using a Fitbit monitor that we gave to any player who was concussed. We did a cervical exam, which was a fairly broad clinical exam, but also included a relatively unique neck strength test, which I can talk about. And we also did a vestibulo-ocular test, which included King-Divic, the ICS Impulse high-speed goggles to look at a battery of vestibulo-ocular tests. And we also did a balance testing, which followed the BESS protocol, but on a force plate. So we looked at center of pressure changes rather than just number of errors. We actually looked at both and compared them. So that was on 135 players. 18 players ended up getting concussion in the season. Two of those players got a second concussion.
Okay.
And I suppose when we were looking at this originally, we had a couple of key questions. And we were trying to identify, okay, how long does recovery take for these kids? We were trying to say, does a battery of objective tests improve the assessment of concussion? So if you just ask them, how do you feel? Is that enough with a scat? Or do they say, yes, I feel good, except they don't pass the Buffalo test? Or you realize that they still have dizziness, and while they don't tell you, when you do some of your vestibular tests, it becomes obvious. Or you fail the King-Devick test or whatever. So that was what we were originally looking at. I wanted to identify those key things, and those, I suppose, battery of tests allowed us to do that. It was difficult. It had several logistical problems. The clinic, sports surgery clinic, is in North Dublin. These schools are in South Dublin, and that's maybe 30 minutes, but 30 minutes was one problem. The testing took 3 hours. So the commitment from the clinic to support testing, we got 130 kids through testing at baseline. So I'm hoping to publish a paper on the baseline reports, and then a separate paper on the changes that occurred during concussion and over the course of recovery on the kids who got concussed. So we have all our results. We have analyzed all the results. I can tell you how it looks, but I'm in the final stages of both those papers and hoping to submit them realistically before July.
Great. Well,
now, I suppose the key point. Yeah, sorry, you ask.
Yeah. For the 18 player concussed, did they have rehab, or did you just assess them after concussion and a few weeks after?
It would be negligent to not give them some advice and rehab. So, we included, you need to sleep well. You need to eat well. If you have symptoms, you need to report them. You need to do some exercise. You need to start moving your neck. So yes, absolutely. We used the Buffalo to prescribe our exercise. So if they failed, even going back a step, we tried to see them 3 times over the course of their recovery. So you have baseline in August.
Okay.
Season starts end of September, October.
Okay.
The cup rugby is knockout. So in the first round, we lost 2 teams. We had not planned very well for that. Yeah. So we lost 60 participants after one round. Now, they played some league games and everything in advance, so that was okay. Yeah. But by January, we were down to 3 teams. And the final is in March. But you know what? It was still okay. That's probably something you would look at again in the future. You would go look at a league rather than a knockout competition. But what we realized was, okay, logistically, it was difficult to get them get them out to the clinic and assess them. But also it was difficult to get them to come back when they were symptom free. So they probably say to their parents, no, I feel fine. I don't need to go back. And in Ireland, which is good, we have a mandatory 23 days at schoolboy level. So you cannot play unless it's 23 days after your concussion.
Good.
So that helped us. We thought if we got them out 3 times. So we saw 14 guys 3 times, which is not too bad. We did not complete every single test every time. And we were able to do the questionnaire on 134 of the 135 in the baseline. So we have quite a lot of data around, risk factors for concussion, general sort of epidemiology of the population and beliefs around concussion. So I think that will be quite interesting to put in the first paper. And then the second paper, as I said, is really just about the changes that occur. I think what will be very interesting to show is that very, very few of the kids were better within 1 week. And the majority showed a decline in performance of objective tests that paralleled with a reporting of symptoms still within 7 days of the concussion. And what it showed by almost day 14, the majority of those kids were very close to returning to normal. And that was not only in the SCAT, but also in the objective tests. For me, which is what is most interesting, is the neck strength test is something that obviously doesn't really affect your decision making at the moment for should somebody return to play or not. But we looked at isometric neck strength using a valved device, but it was before the force frame was designed, where we got a seatbelt from a car and wrap it around the head, attach it to the load cell, and measure through the force transducer how much force they are producing while sitting down, pulling into the harness in each direction, forwards, backwards, left, and right. There was no movement in the harness, so it was solid, so it was in neutral position. And we measured force, and what it showed was there was a decrease in neck strength 1 week after the concussion. And at week 2, it had returned very, very close, at least within 90% of normal. Now, there were some outliers that did not change, but as a population of 18, which is very, very small, I know, it showed a decrease at least. And I think this gives us enough hope to say, okay, something is happening here at the cervical spine as well, that maybe we need to look at a couple of more markers and possibly extend that out to more of a neck function assessment rather than just neck strength.
And you said, so after 1 week, you can measure a decrease in strength. In which direction? All 4 directions?
Yeah, very good question, Julian. Yes, all 4 directions, but interestingly, the biggest reduction was in which direction, do you think?
I'm pretty sure that the flexor are less strong than the extensor.
Yes.
And I would like to think that it's maybe the one who decreased the most.
Yeah, you're correct. Yeah, in our group anyway. And that fits with some of the work by Kerry Peake's group in Australia at the moment who are looking at soccer. But absolutely. So this is something that I have a clinical interest in and I do think is important, is when you are looking at cervical spine, you need to consider, okay, how strong are they, number one? So same as an ACL. Okay, so you look at an ACL, how strong, do you measure isokinetic in ACL?
Yeah, we do. Yeah.
Yes, why? So you look at your quads and you look at your hamstrings, right?
Yeah.
So yeah,
exactly.
It's basic and maybe does not tell you if the person can run or not, but you know that, okay, if they produce 250% force of their body weight in their quads, that they're going to be relatively okay. If they produce 170% of their body weight in their hamstrings, then they're going to be okay. And you want a ratio roughly of 1 for quad to 0.65 to 0.7 for their hamstrings. Okay? And give or take around that, you have to have symmetry with the other leg as close as possible, but definitely within 0.8, 0.9. Okay, so you say, okay, let's look at the ACL at 6 months or 7 months. And even at 4 months, you want those figures to be looking good as a predictor of return to run. So for the neck, we don't really look at that at the moment, even after neck surgery. But I think relative to body weight, And this totally depends on the sport. Okay, so I can only talk more confidently about rugby.
Yeah.
But generally speaking, at professional level rugby, if you can produce 4 newtons per kilo in extension, then I think you're going to be okay. So if you are playing in the back row, number 7, 6, 8, you weigh 100 to 110 kilos, you need to probably be producing over 400 kilos on this on this next strength test. It might be different with the force frame.
Yeah.
And then, okay, so what is flexion? So for schoolboys, flexion, the extension seems to be around 200 to 250 mark. For front row, it seems to be closer to 300 for schoolboy. And some schoolboys are very strong, so they produce 400. Front row in Ireland, the top guy that we have measured was close to 650 newtons into extension. Okay, so he weighs 120 kilos, but he's producing 650, almost 700 newtons into extension. Now, not to get distracted on this point, but I think the flexion or going forwards, at the top professional level, you want that to be as close to 0.8 as you can. It's very hard to get there. But if you have 100 newtons extensor, you want this to be 80 forwards. But you will see lots of 0.7. You will see lots of 0.7. And because the front row forwards can produce so much power in extension, sometimes they actually have a bigger differentiation between forwards and backwards than the other guys. But if you think about scrummaging, it's not just pushing up. There is a co-contraction required. So your flexors primarily stabilize the spine.
Yeah.
So therefore, your co-contraction works to stabilize. So the importance of the ratio, I think, is good. I think left to right, you need 1:1 if you can. And sometimes when a player has a radiculopathy or some sort of left-sided shoulder injury, you often see a deficit on that side. So again, that can be an area for rehabilitation or focus or targeted neck strength work. But looking at the ratio in schoolboys, it's around 0.55. In females, it's around 0.5, maybe a little bit less. In chronic neck pain, it's around 0.3 to 0.4.
Okay.
And in elite professional rugby, I think it's around 0.65 to 0.8, ideally. But I've never seen somebody with stronger flexors than extensors, but there has been 1 or 2 studies published that have looked at this in a soccer population in America, but I don't think that's accurate. I think what you will find is your extensors are stronger. We also have looked at a lot of jockeys, like about 400 jockeys, some of them the same guys. But we've tested jockeys over 400 times in the clinic over the last few years, and again, their ratios, their strength scores are smaller. So think about the ACL again. They're relative to body weight, they're not that dissimilar.
Yeah.
So 4 newtons for extension per kilo. So if these guys weigh 65 kilos, they're producing around 280 newtons. And again, work off.
Okay. Did you tell this? Yeah. Did you tell this to the rugby player?
I don't know. I don't think so. So, some of those guys know each other anyway. The jockeys are fascinating. So they return to play very similar to rugby. It's, 6 days. But their process is both of them are pretty strict. The jockeys, through Horse Racing Ireland, put a really big emphasis on neuropsychology, where the impact test alone is not completed, but it is referred with a pen and paper test. I don't know if you have ever seen this. It's a neuropsychology test that is a little bit old school, but is assessed by a consultant neuropsychologist who looks at the performance of the score and breaks down their impact score with the individual game outcomes, and looks at that as a really big indicator of return to baseline. And they have quite a high failure rate still, even though the jockey will self-report that they are ready to go. But the system, both in the rugby and in the jockey service, is really good. Is really good. I think there will be a time when it comes when they might look to change the return to play time, but that's given the fact that lots of the jockeys don't quite make it back within 7 days. But again, it can be very difficult to get some of this stuff published and pushed through. But in terms of ratios, whether this has relevance to concussion, I'm not convinced, but something is happening. And you need to think about, is this neuropsychological? Or physiological, I mean? Is it neurophysiological? Is there some sort of downregulation of muscle activation in the cervical spine muscles? Reduced innervation? Is there something to do with the presence of neck pain? And we've recorded that in the study. Is it something to do with an inability to perform a maximal strength test? Or is it just coincidence? And that our population was so small that you look at it in a larger population and you don't find any difference. So we were planning on doing that study with the RFU, but unfortunately we weren't able to get that pushed through.
And the other thing we have to think about is, what do we have to do in rehab? Because we know there is this decrease, you said, and do we have to make it better to accelerate the recovery and the return to play? When do we have to start to work on it, on strengths, neck strength? Is it at day one after concussion, or is it too early? Do we have to wait 2 weeks?
No. You don't really. So with concussion, there's 48 hours where you need to be sensible, and the immediate brain injury episode needs a little bit of time. It's where relative rest is important. So normally you just base that off. Make sure you don't provoke your symptoms. And I think that is really important. So, sensitivity to light, wear sunglasses. Sensitivity to noise, maybe wear headphones for a few hours. See, does that help? Yeah, exactly. So just, reduce fear, reduce anxiety, normalize the situation, but also be very, very smart and know that it is a brain injury, and you need to reduce the sensitization of the brain and not make it worse. So the environment is really important, and education forms part of creating that environment. So that's the first step. In terms of when do you start neck strength? I mean, I don't think you start neck strength as an exercise post-concussion. I think you start exercise as a recovery post-concussion. I think, the incidence of neck pain in our concussed cohort was 70%. And that's, fairly commonly seen, where neck pain is, often one of the top 5 symptoms reported. And the crossover between sensory motor dysfunction, which could happen due to injury or certainly impact of the upper cervical spine. If you have vestibular or ocular motor dysfunction and the crossover with the innervation from the upper C-spine, so you can have inhibition of the muscle there. You could have inhibition of the neck muscle just from call it a whiplash mechanism, or certainly the injury to a neck. You could have a custom or accompanied shoulder injury, which can affect neck function. So you need to assess your neck, and that's the number one thing to do. You definitely need to look and see, are there obvious deficits? And I suppose what I recommend is, when do you measure neck strength? And if it's a 6-day turnaround return to play process that you're following, well, on day 3, you return to some form of strength training. So I would say if you can push dumbbells, then you're safe enough to, push on the neck harness. But it's to be guided by the therapist at the time. I mean, it needs common sense. So you want to measure it, first of all, to see, is there a deficit, but also start exercise relatively straight away. You want to restore normal range of movement. You want to restore normal function. And as you know, the less you move, the quicker you lose function. So you have to try and encourage movement. And sometimes you might start with some sensory motor type exercises rather than just neck strength. But again, I think I've showed you before a load of exercise where you might just use a TheraBand or a black band around your head to provide just some very gentle resistance. And that's as much, it's like doing no weighted squats or, body weight squats, where you're just trying to restore muscle function again. And that helps to normalize muscle tone and improve contraction.
Perfect. Thank you, Colm. Colm, how do you manage an unusual week? You talked before about your family.
Yeah.
We understand you have a big job, and how do you manage? Do you have day off, or do you work every day a little bit? How do you do it?
Well, I don't work weekends at the moment. So without sport, I don't work weekends. So that's great.
Great.
We have a baby, 6 weeks old, a little boy, and he has 3 older sisters, and his oldest one is 5. So it's a busy house. So maybe, and my wife works full time as well. So so how do I manage my week? I suppose most people, in high performance, one of the big challenges I had was working with the national team is like you start to normalize some behaviors that are a little bit extreme. So like you work with the international team and, every one of them is almost on some form of fasted diet. Every one of them, is elite in terms of their level of exercise compared to Joe average or Joe normal. Every one of them is relatively a high achiever. And when you live in that environment for a while, unless you're able to go on a watt bike at 400 watts for 40 minutes or bench press 2 times your body weight, you're not really achieving. So whereas in the clinic, I think we have a lot of high achievers too, but a lot less pressure to conform to different societies. So I think younger physios might look at me and think my life is a bit crazy, but it depends what stage of your career you're at. I really enjoy helping younger physios. We have a large turnover in the clinic, and that has been intentional for years. And turnover, I mean, our junior contract is about 3.5 years in total. So they come in ideally straight from university, and we always try and recruit new graduates. And they do a year in orthopedics just in the hospital, or maybe 18 months, and then come into sports medicine on a rotation for 2 years. And we try to encourage that. And while some have stayed on a little bit longer, nearly all of them end up leaving at some point. So since 2014, I looked recently actually, and I have managed over 75 physios during this time. And our second part of recruitment is at senior physio level. And recently we have just advertised 4 new PhD positions where you work 3.5 clinical days and you have 1.5 day a week to do PhD in a very targeted biomechanics driven focused area. So for me, I have 3 clinical days at the moment, 1 day to do my PhD and 1 day to manage. But like you said, I'm quite good at keeping clinical Tuesday, Wednesday, Thursday, but there is a large crossover. I work most nights after 8 o'clock. It is definitely a challenge on family life. We try and get the kids to bed by 8 at the moment, but that won't last forever. But it is hopefully, in the last year of my PhD, I'm in the writing stage now, which I find probably the most difficult. I have all my data. I have it more or less all analyzed. So it's just a case of finding time to get that submitted. My management role is look, it's constant really. We manage communication between physios, we manage their development, manage recruitment, manage problems with the clinic, complaints or, people looking for more help or redirecting patients in a different direction. We manage communication with the consultants, with external referrers, and also, I suppose, to a degree, the development of the clinic from a professional development point of view, I mean, where you're doing an education system externally. And all the time I'm trying to finish my PhD while doing this. So it is a great job, relatively unique, given the amount of physios we have in certainly in Ireland anyway. It's fairly unique in that we get to work with sports medicine consultants. So it is also a learning curve every day. You get to learn something new every day. And I suppose the best thing is you get to experience lots of different people. I think that's, my clinical caseload, I suppose, of interest is probably 50-50 in terms of athletic population and less athletic population. I would say maybe
well said.
40% of those tend to be spinal, and of that 40%, I would say 80% are cervical spine, and I probably see somewhere between 3 and 10 concussions a week. So it varies, concussions, as you know, tend to be the ones that are not getting better. So car crashes are very difficult. I much prefer the sport-related concussions, purely because the context is so important. I also prefer seeing concussions that come in soon and not 2 years ago. They are very, very difficult to do. Yeah. And we're building a network around Ireland and externally in other countries of trying to get the right people to provide the right resources. Things like neuropsychology or very specialist vestibular care are oversubscribed in Ireland, and we don't have them in the clinic at the moment, but we have a good referral system to those professionals, and I see that as being a big part of the job as well. We're very lucky we have a huge amount of elite athletes coming through the door on a daily basis. We see most of the top GAA players in the country. See the jockeys, we see MMA fighters, UFC fighters. Lots of players have come for residential rehab to the clinic over the years, and some of my colleagues have really done an unbelievable job to develop world-class facilities that we have. So that's one big attraction.
It looks amazing. And you told before about few people who inspired you in your background, and can you just pick a few of them who are your mentors?
What I should have said is I'm extremely lucky to have Professor Catherine Schneider as my clinical supervisor on my PhD with Professor Aina Falvey. So Aina is obviously Chief Medical Officer for World Rugby. Catherine is a Professor of Kinesiology and Concussion Specialist. She's a clinician scientist by trade. As you know, she is a very formidable presence on the concussion sport working group, and is playing an instrumental role in the development of the future of that, to be honest, and is really trying to drive the academic aspect of it, but also trying to drive change within the group. She has amazing work ethic, and she's certainly somebody who has provided an incredible level of support to me, has allowed me during COVID to participate in so much of the Calgary education program. Like, I'm not sure how familiar you are with the group, which is mostly run by Caroline Emery, but it's the CIPRC stands for the Sports Injury Prevention Research Centre, and they have some of the most amazing PhD students, postdocs, professors, and even undergrads working in that department, where I've been very lucky to get almost 2 years of access to over the last 2 years. And that has really allowed me to develop analytical skills, statistical skills, but upskill particularly in concussion. Their CPD program is amazing and still luckily is online most of the time. So she's one. Aina, as a person and as a clinician, has been an incredible support to me. He's the one that has pushed me the most to do this PhD, but also to finish it. But he is available 24/7. He has essentially set the path for the direction of sports medicine in Ireland, and has obviously worked at the elite level in rugby, but is also, unbelievable family man, is highly regarded in his hometown of Cork and beyond, and he's just a really good person and a good doctor. So he's been a big inspiration and support for me. I suppose, look, at home, obviously my family is very important. My wife somehow manages to work full time and is much busier than me. So, and she has managed to drive the house here. So that's obviously really important for us to try and develop the family side of things. So I was lucky to grow up in a house with a very supportive mother. So I think that's also something that I find helpful, having a very good family network. I don't know how you can do a PhD without it, really, because it certainly brings a lot of pressure. But it is one that I am grateful for. There have been loads of people that I've tried to mention along the way that have had various influences over how I got this far. Yeah, they would be the main ones at the moment with where I am in my career.
Perfect. And what's your favorite book? If you have 2 or 3 of them.
I at the moment, because of time, I listen to podcasts.
Yeah. In your career.
Do you know what? So David Joyce's book, High Performance Training for Sports, is actually a really good book to buy for a physio. It's really good. If you're working in team sport, I have to say, it does allow you to reflect and look at different aspects of things. I get obsessed with learning about leading and managing people. I think fun and happiness and enjoyment is a really important part of an environment. And, I was listening to a podcast where Stuart Lancaster was talking, and he was talking about how he's the opposite to that, but he feels the need to have somebody in his environment to be the opposite of him to create balance. So I think that was a very good, interesting point. The most recent one I've listened to, I commute by bicycle to work, so I listen on the bike. But Martin Boucheit's Boucher, is it? His Hit Science podcast. The book is great, but the podcast Hit Science, HIIT Science, so high intensity interval training science. It's a great podcast, really good. Like that. I also am becoming obsessed with the idea of flow, and flow is to do with productivity. And Caelan Doris, who plays number 8 for Ireland, his brother Rian Doris studied neuroscience in UCL and moved to Los Angeles, and he looks Californian too, might I say. But he, along with Stephen Kotler, who's a performance psychologist, have set up this thing called the Flow Research Institute. And they have some very, very good podcasts around productivity, focus, learning, neuroscience, how the brain works, how you can improve your own performance. I think it resonates an awful lot with where I am in life at the moment, because I don't have 8 hours straight to be productive on a certain task. So I'm trying to learn how to switch into something, and then when I'm in it, to really, really focus on that, and then to be able to switch out of that too. Because I think I'm really bad at that, actually. I often come home from work and I'm at home, but I'm thinking about work all the time, or in work I'm thinking about home. So it's trying to learn how to, particularly for the last stage of the PhD, if I have 2 hours. And this is something that Aina will always say, take 45 minutes and do nothing else for that 45 minutes. And what the Flow Research Institute talk about is how you actually do that, how you plan your time so effectively that it's easy to do it. You put way more energy into the planning and the creation of a strategy then the actual doing becomes far easier. And I think there's something in that for people who are very, very busy or juggling several different tasks. So that would be my particular focus at the moment.
Nice. And if people who are listening to us, if they want to contact you, where can they find you on, I don't know, Twitter and LinkedIn? Where are you available?
I'm on both. I am not great at tweeting. To quote a famous rugby player, a little bit of me dies every time I tweet. But I need to get better. Maybe when so I have a paper accepted. My reliability paper on the neck strength test has been accepted. So hopefully that will be published in Musculoskeletal Science and Practice within the next month. So maybe I should tweet about that. But I think I'm on all those things. Yeah. So email is also good at work. But any way at all, if anybody wants to make contact, I will try and always get back.
Yeah, perfect. Colm, thank you very much.
Yeah, well, thank you. I hope I didn't waffle too much, and I would think that you are doing a really good job. So fair play for trying to do this in a different language. It is very, very difficult.
Yeah, you're right. Thank you very much, Colm.
Thank you.
Bye.
See you, Julien.
Voilà. Thank you for listening until the end of this episode. I hope you had as much fun as I had recording it. If you want to help me, the best thing is to share this episode to as many people as possible. Talk about it around you. Debrief it with your colleagues. What have you learned? How can this episode help you? Feel free to give me feedback or suggest people to interview. I will be happy to answer. See you soon for a new episode.